Hello and welcome to UWO Now. I'm your host, Wendell Ray. Thanks for joining us with another conversation with a member of the UWO community. Teresa Connolly is Associate Vice President of Delivery Services at Mayo Clinic International. Teresa holds the rank of Assistant Professor of Nursing at Mayo Clinic College of Medicine. She also holds the rank of, or is a fellow in the American College of Healthcare Executives. She also is a graduate of UWO and is our guest today on UWO Now as we discuss healthcare today and in the future. Thank you so much, Teresa, for joining us here today on UWO Now.
Great. It's really a pleasure to be here with you all today, and I look forward to sharing with you my healthcare journey and some other comments with Wendell.
So tell us about your journey to UWO, first of all, and then we'll talk about how you got to Mayo Clinic. But what was it like for you when you were a UWO student?
Yeah, so I am originally from Wisconsin. I actually grew up in Wausau, Wisconsin, and had a desire to get into healthcare, a field where I was really making a difference in people's lives ever since I was in high school. So looked at a few different healthcare career options and obviously settled upon nursing. And the UWO-Oshkosh nursing program was a recognized program, and I felt really proud to be accepted into that program, and it really did prepare me for a fabulous career. While I was at Oshkosh, I also got involved in the Greek life. So I was a member of the Gamma Phi Beta sorority and have made lifelong friends through that connection, and really felt that it balanced out my time at Oshkosh. So I had great academics, but through the Greek life, I was able to network and get involved in different volunteer type of programs and projects. And looking back as an adult to that Greek life experience balanced with my academic experiences at Oshkosh, I really feel like, again, lifelong friends, but also prepared me with some other skills that have really benefited me in my adult life.
And then you left UWO, got some additional training academically, and then end up at the Mayo Clinic. Why don't you describe or detail that path for our listeners?
Sure. So as I mentioned earlier, Wendell, I grew up in Wausau, but during my college time, my family moved to the East Coast. My dad took a job in New York City. So I kind of felt like New York really wasn't my calling. So after graduating Oshkosh, I relocated to Chicago and started my nursing career at Northwestern. Worked on a med-surg floor again, felt really prepared from my nursing preparation and enjoyed that time clinically. I was really early on put into a leadership position. In fact, in the first 6 months, I became team leader of a med-surg floor. And I'll tell you, at that time, I realized I was not as well equipped for that role as I felt I should be. And I also was introduced to a new aspect of nursing, and that was leadership. So I pursued a master's degree at Loyola University in Chicago, and really felt a great foundation there. In fact, I went on to get a doctorate in nursing practice from Loyola some years later. So after I graduated with my master's in administration, I really did chase that as a career pathway for me and gave up my clinical practice. Moved to Arizona about 27 years ago, and this is home for me now. I've been at Mayo Clinic for 26 years. So when I started at Mayo Clinic, we were building our first Mayo-built hospital as an organization. All the other hospitals Mayo had were either acquired or from the nuns in Rochester, for example, or other communities across Minnesota and Wisconsin, and even in Florida, one of our other destination sites. This was the first built one, so it felt like quite an honor. When I started, Mayo Boulevard, where the hospital is located today, was a dirt road, steel scaffolding coming out of the desert. So I've literally seen this campus come to life. It had been a clinic in the valley before then. Have had a really progressive career at Mayo Clinic in Arizona. Started as a manager position and worked my way through the ranks, and I served as chief nursing officer for 11 years before joining the international team 4 to 5 years ago. Did some transformational work there, received magnet designation, started a nursing school with ASU, and really advanced and grew the practice of nursing in Arizona to what it is today.
And what is a magnet designation?
Yeah, thank you for asking that. So magnet designation is kind of a designation of excellence. Not many hospitals have it throughout the country. I can't quote you the exact percentage, but it could hover around 10%, for example. And you have to demonstrate research, nursing excellence, shared governance, and we were successful in that journey. And I'm proud to say that Mayo Clinic Arizona retains that designation yet today.
I would imagine, Teresa, that you've seen a lot of different things come and go in your time as a healthcare professional, but I would imagine also that the COVID period was a trying time for healthcare workers, healthcare facilities, healthcare leaders. Tell us about how you navigated those waters during a very trying time for the country and the world, actually.
Yeah, so Wendell, 2020 was a life-changing year for me personally, and obviously for the world. That was the year I joined the international team. So I was in Abu Dhabi for that year, and I'll back up to 2019 just for a moment so you know how I got there. In 2019, Mayo Clinic was going through a due diligence effort and doing some consulting with a hospital that was a state-of-the-art hospital in Abu Dhabi, getting ready to open. I was the nursing rep in my chief nursing officer hat there, helping guide that. Made about 4 trips to Abu Dhabi that year. And then in November of 19, Mayo Clinic decided to sign a joint venture agreement with this organization. So we went into partnership. The hospital opened in January. Mayo's model is a dyad model. So our physicians always hold the rank of our CEO, our presidents, they are our leaders, but they always have at their side an administrative partner. And that role is the chief administrative officer. So they hired and recruited the CEO, Dr. Nasser Amash, but they came short on the CAO. So I was asked to go over there in January for 3 months to help kind of bridge over into the continued recruitment for that CAO position. As we know, the pandemic hit. So my 3-month gig turned into 11 and a half months. So my experience with the pandemic was at a brand new facility that had opened on the other side of the world and trying to navigate a startup, another culture, and a pandemic. So one of the things that I'm really quite proud of in that experience, many things, but one of them is a project we call Operation Hope. So hospitals typically, when they open, they don't open at full capacity. They open slowly so that they can ramp up for all sorts of quality and safety reasons. Our hospital census surged. We were about a roughly 800 bed capacity hospital. We started probably in the mid 200s to get us going. And we surged by over 200 patients in about 2 weeks as soon as the COVID population and the pandemic started to settle in.
Wow.
So we quickly found ourselves short-staffed, you can imagine. We're not staffed for that. Nobody really was. But when you're a brand new hospital and you've doubled your census, you're really short-staffed. So we launched a project I did back with my colleagues in the U.S. called Operation Hope. And Hope stood for helping our partnership expand. And in a matter of about 3 weeks, we got Etihad was the airline that gave us a jet to fly from Abu Dhabi to Rochester, Minnesota. We brought over 90 caregivers, physicians, therapists, nurses, and alike to go and deploy to Abu Dhabi for 6, 8, 12 weeks to care for this surged patient population. We had to cross cultural barriers, licensing barriers in another country, onboarding, and just getting accommodations and everything together in 3 weeks was a pretty proud teamwork effort on behalf of myself and my colleagues. And since that time, obviously we've gotten on the other side of the pandemic, and SSMC over in Abu Dhabi continues to make a difference, bringing in new procedures, practices, and advancing healthcare for the UAE.
You picked up 90 healthcare workers. From where? Where did you get them from?
So they were all Mayo Clinic employees, and the timing was serendipitous. So every crisis kind of has a silver lining. And if you think what was happening back in the U.S. during the pandemic, surgeries were being canceled, right? Just routine healthcare was being minimized so that people could care for this new patient population. So we actually, as Mayo Clinic, since we were canceling so many surgeries and such, we did have a surplus of staff. So we were able to bring 90 staff, and Mayo Clinic is an organization of 65 plus thousand large, right? So we have a large number to pull from. And these staff came from all of our sites: Rochester, Arizona, Florida, Wisconsin, Minnesota. So all of our sites leaned in, and 90 might sound like a large number. It really made a difference in Abu Dhabi, but a healthcare organization our size was able to contribute that without too much negative implications back home.
What COVID adjustments that you had to make then are you still using now? What type of new procedures then have become standard operating procedures in healthcare that have benefited both healthcare providers and patients?
Yeah, I think so. One of the things I did make a few trips during that pandemic year from Abu Dhabi back to the US, and how both cultures were handling that as countries, not just organizations, handling the pandemic was vastly different. And in Abu Dhabi, social distancing, taking precautions, and doing what other healthcare experts asked you to do was done without question. Where in the US, it is a bit controversial. Should you mask? Should you not mask? Should you get the jab? Should you not get the jab? The one thing lasting, though, I think I have seen that is a benefit is people take getting sick, I think, seriously, and the ability to spread illness to their colleagues or friends or families. So people stay home from work. Maybe they do remote work if they're not feeling well. Individuals may not attend large social functions because they're not feeling well. I think in the past, sometimes people thought, oh, I'm okay, I'll just go in. Maybe not quite realizing the ability they have to spread their illness to somebody else. And that obviously plays forward with the flu, COVID, and other kind of communicable diseases.
What about something like telehealth? Has that been something that was new and now has been adopted?
You're absolutely right, Wendell. So, telehealth during the COVID period of time, even some licensing concerns that we have from cross-state practice, some of that was lifted because telehealth was just necessary, right? Was just necessary. And I've noticed licensing and other agreements and insurance coverage for telehealth is actually improving. So I do think that is definitely a positive change. So thank you for picking up on that.
You're listening to UWO Now. I'm your host, Wendell Ray, and we're talking with Teresa Conley, Associate Vice President of Delivery Services at Mayo Clinic International. You've been around the world setting up healthcare facilities, Teresa, for a number of years. What differences in healthcare delivery are there in the places where you've been?
Yeah. So I'll tell you, the one approach you always have to take, not even just dealing with cultures abroad, I think cultures and diversity in the U.S. as well, is curiosity. Just always be curious. Don't make assumptions. Things get you in trouble quick. So my time in Abu Dhabi was, as I mentioned, transformative. It was the pandemic, but a very different culture than I worked with on a day-to-day basis. Muslim country, very accepting, very embracing. I had lots of questions about what it was like to be a woman leader over there. I never had any issues. Very respectful to me, to my family, and supportive. After my time in Abu Dhabi, I did transition over to London. We have Mayo Clinic has a small clinic there. And as you recall, back in the pandemic, London got hit pretty hard. Everything essentially closed down in the city.
Yeah.
And then started to reopen in 21. So I was asked to go over there in the summer of 21 to start to reopen that clinic. And we did so, right? The clinic is back open, it's running smoothly. But I'll compare and contrast just for a second my experience in Abu Dhabi and then my experience in London. So in Abu Dhabi, obviously, doesn't take much to recognize that there's probably really big cultural differences. In London, I personally made the mistake of thinking that there wasn't as many cultural differences and I wasn't as curious, and I probably assumed a little bit too much. So when we were going over there trying to get London restarted, we were bringing a lot of the Mayo US norms to them because we felt that's what they needed. And that quickly, probably on my second or third visit over there, sort of backfired a little bit. And the team actually asked the US side to slow down, be more sensitive, and embrace where they were at and how healthcare is different. So it was a reminder to me to be curious, don't assume, and meet them where they're at. So in London, for example, they have a public health care, and Mayo comes in as a private healthcare provider. That's very different than the US setup, and something that you can't take for granted until you're over there and you need to engage the local team on how to navigate that.
So, okay, that makes no sense to me. So tell me what that means. Okay, so I understand what public health is, but what is the dynamic there? What is the relationship between public and private healthcare? And why was it necessary? Does that mean they were like our departments of health and state at a state level that you were dealing with in London? Is that what you're talking about? Or what was that relationship that you had to kind of reevaluate how you're going to work with?
I get there, yes. So the public healthcare is where I would assume, actually I can't go to a statistic, most of the citizens of England receive their healthcare from, right? Private healthcare is typically a cash pay type of setup. There are some insurance companies that will pay for care, for example, expats or those that may be living abroad, from abroad living in London. They may have insurance to cover at the clinic. So when you think about wellness, for example, wellness care, in the US, we will get maybe an annual physical paid for by a healthcare insurance company to go to a provider. You may get your immunizations. Wellness care and preventative care are not things that are covered in London. So when you set those up, you have to recognize that you're setting up those as private healthcare packages and need to make sure that you really think about the value that you're offering. So it creates a different marketing scenario for you that you don't have to think about in the US, because we have guidelines and such that say you need a mammogram so many years, right? Mm-hmm. You should have X number of vaccinations. And in London, that is all typically out-of-pocket expense unless you happen to have a foreign insurance company covering you as an employee.
Okay. So some growth there, I guess, adjustments. Let me ask you this. You've been mentioning clinic, and that's what Mayo calls their facilities. Is there a difference between a hospital, a clinic, and what levels, or what are we talking about, if there is any difference?
Yes, you're right. So that's a good question. Mayo Clinic gets this quite often, actually, because our name is Mayo Clinic. So clinics are outpatient practices where most of us get our care. Some of us may never spend a night in a hospital, right? Most of us get our care through clinics. So when I say Mayo Clinic, I'm referring to our brand. There are also clinics, a part of Mayo Clinic, and hospitals. So the hospitals are the acute care where if you need to stay overnight, those are typically where you have your high acuity care. So think about transplants. Top of the pyramid, we call it cancer care, where you may be getting high-tech radiation therapy and other infusions. Those type of procedures and that care level takes place in an acute care facility or a hospital. The clinics are all outpatient. In London, it is a clinic. It is a small outpatient facility. Mayo Clinic does not have a hospital practice there. We have physicians that work for Mayo Clinic, and then we'll also have admitting privileges to a hospital if they needed to admit their patients somewhere they would go to a local hospital.
Okay, thank you. You're listening to UWO 9, Wendell Ray, and we're talking today with UWO graduate Teresa Connolly, who is Associate Vice President of Delivery Services at Mayo Clinic International. Teresa, what can you say about training, the necessary training now that you need to have as a healthcare professional, maybe as opposed to when you graduated UWO? How has things changed? What are some training that you think is necessary for a healthcare professional?
Yes, that's a great question. So for one, I think there's technology, right? The level of technology that was in place when I was a new graduate starting my career is nothing compared to today. So the one thing I would say, and I actually think it's probably not advice I have to give, I'm hoping that our younger audience does this automatically because they are natives to some of this tech where you and I are not natives because we just didn't grow up with it. At least I didn't. So technology would be one. The other thing I would say is things are moving so rapidly and quickly to make sure that you stay up to date. I cannot overemphasize, I guess is a better word, overemphasize the need to be a lifelong learner. Something I've embraced myself with certifications, regular reading, membership in professional organizations. You have to be a lifelong learner and not feel that you've got your degree and you're set. That things evolve and change so rapidly. Really find your pathway and how you're going to continue to get those skills.
One of the big tech advancements that we've been talking about and that affects everyday life, and I'm sure it will affect or has affected healthcare facilities and healthcare delivery, is artificial intelligence. What's the conversation about AI in the healthcare industry, Teresa?
Yeah, so I'll tell you, I think I'm very fortunate that I work for a progressive organization that embraces technology and has this culture of innovation. One of the projects that I'm working on right now, we are submitting tomorrow on Friday an AI grant to see, and it's a competitive grant, see if we'll get it for one of our projects on how we can advance international access for our patients. So how do we make that process more smoothly and augmenting AI? We're looking at chatbots in our appointment scheduling space and other ways to embrace innovation. And I find that, again, my organization really welcomes that and encourages it, sometimes in a competitive fashion like this grant. And we learn from each other, right? Trying to be our best at all things we do.
Has AI in some form already been a part of what's going on in healthcare? I mean, I had this question to another guest once, and he basically said, well, AI's been around for like 9 years, and we just have all of a sudden seen it ramp up. The use of AI and so forth in practical applications. Have you seen that type of use already in effect in the healthcare industry?
I think yes, but I think people are getting more, it's becoming more normalized.
Okay.
I think about AI, the generative AI that sort of evolves and things are put together and gives you new solutions versus an algorithm is just put in place and it helps you direct care. Mm-hmm. That there's other types of AI that I think are coming into our spaces. And I'll tell you personally, I'm even recently embracing some of this myself. So for Oshkosh, I had to do a new headshot and I did not have time to go get a headshot made. I just didn't. It was on my list of things to do. I got an AI headshot and I used 2 different companies. One of them was not so hot. And then the other one was eerily exciting because these pictures look like me and I didn't take a single one of them. So I think
interesting.
On a personal level, I'm getting better with this. There are ChatGPT softwares that I'm even beginning to use for how I plan a meeting. If I've got a topic in mind, asking for an outline and just helping me get started and be more efficient at the work I use and do. I'm hearing that type of conversation, these use examples I've just given you, more normal among my peers. Now, again, we're of the same age group. Again, take people a couple decades younger than me. Maybe they've been doing this for 5 years. But I'm just personally getting into that space and a lot more comfortable with it than I was not too long ago.
Okay, great. That's interesting. I'd like to know more about that headshot and how that works. But I want to thank you very much. Thank you very much for joining us here today on UWO Now. It's been good to meet you, and congratulations again on your recognition as a distinguished alumni, one of the distinguished alumni from UWO.
Thank you, Wendell. It's been a pleasure to be here today.
Okay, that's all the time we're going to have today. Thanks for listening, everyone, to UWO Now. Remember to catch the latest episode of UWO Now. Go to our website, wrst.org, or you can also watch it on the UWO YouTube page. I'm Wendell Ray. Thanks so much for listening.